I think we all who work in Cumberland know of the mural, know its history, it's widely talked about, but in recent years not everyone has had an opportunity to see it. My name is Tracy McDonald, I'm the library manager here at Cumberland Hospital Library.
I walked into this room, the lights were off, and I remember looking around and I was encircled by this incredibly vivid imagery. And what struck me most was why did this even exist? So my name is Greg Demore. I'm an Associate Professor of Psychiatry and I'm based at Westmead Hospital and Cumberland Hospital.
I actually remember the first time that I was shown what we refer to as the Mural Room, and it was a really mind-blowing experience. It's very overwhelming when you go in and see it, and I think in a good way. My name is Claire Ambrose. I am a library assistant at Cumberland Mental Health Hospital Library.
He painted the mural in 1972. It took about a year. There was discussion about painting over the mural in 1989.
The then medical superintendent, Dr. McSwiggan, who is still alive by the way, had given orders for it to be painted over, to be whitewashed. And what I loved was the moment of insurrection in the mental hospital when the staff and others wrote to Dr. McSwiggan, and with something like close to 100 signatures, asked that he reconsider. He listened and he sought evaluation from an art expert, and that expert's evaluation was that this was of some importance and that it should be kept, and Dr. McSwiggan allowed it to be kept.
And I remember thinking, oh, this guy has to, have artworks for sale, like he has such an incredible story. And at that point I just knew that he had been admitted to Cumberland and that he had been a patient here. And I remember, Googling him for the first time and realizing that he wasn't terribly well known. Like there are sort of sparse mentions. And I think my personal favorite is an article from the Australian Women's Weekly from 1969 that is called Culture Among the Cutlets, and it's about how Arnold exhibited some of his paintings in a butcher's shop in Gordon.
What you can make of his life is that I think he led a hard life. He seemed to have painted murals wherever he could. Wherever he was able to settle for a period of time, he was able to use his art as a kind of thread, something that kept him alive.
He was well liked, quite eccentric. He actually did a sculpture of a horse for a hotel on the way out to Vineyard. It was known as the Tourmaline horse. And it was a 7-metre, 3-tonne sculpture of a rearing horse.
The fascinating thing about Arnold Sinclair's life is that in some ways it really reflects the timeline of psychiatric treatment and mental health treatment in Australia.
I think the story we've heard about Arnold Sinclair and his artwork connects right back with some of the very earliest leaders in mental health in Sydney and on this campus, Cumberland Hospital. The second superintendent was Dr. Richard Greenup, and he was head of this hospital, the Parramatta Lunatic Asylum as it was called back then, from 1852 through to 1866. And what was most notable about him was that he championed aspects of care that we could recognise perhaps in the care of someone like Arnold Sinclair. In that, he championed what we called moral therapy, which was in reference to things like occupational therapy, reducing the amount of physical restraint that patients were subject to, looking at their diet and improving their diet, giving them activities such as art to improve their welfare. So that spirit of enterprise and care and humanity was very evident during Richard Greedup's time, the 1850s and 1860s. And you'd have to think, in some ways, it's reflected in Dr. McSwiggan agreeing to allow that mural to exist. Because somewhere along the way, people could see that was not only of therapeutic value for the individual who painted it, Arnold St, but perhaps it's also of therapeutic value for staff and patients. Patients in particular to see what can be done. That in hospital you can actually express yourself. You can leave something of value. So I think the legacy of Arnold St. hopefully will be a long-lasting one.